Do you ever run your tongue over your teeth and feel that fuzzy, slimy texture? Or maybe you've noticed your gums bleeding a bit when you floss. These might seem like small problems, but they can lead to something much bigger. Plaque and tartar are the culprits behind cavities, gum disease, and even bad breath. But here's the catch: while you can control plaque, tartar requires professional help. So, what's the difference between the two, and how can you protect your smile? Let's break it down in simple terms and get to the heart of what's really going on inside your mouth. By understanding how plaque and tartar form and the risks they pose, you'll know exactly how to stay ahead of these common dental issues. What exactly is plaque? Imagine this: after you eat or drink, tiny bacteria start to gather in your mouth. They stick to your teeth, gums, and even your tongue. Think of plaque as a party of bacteria hanging out in your mouth. Now, it's not just any bacteria, it's 700 different species of tiny organisms that thrive in your mouth. These bacteria form a sticky, slimy film that you can feel when you run your tongue over your teeth. That film is what we call plaque. It's usually clear, but if it sticks around long enough, you might notice a yellowish tint. Here's the thing: plaque is soft and easy to remove if you brush and floss regularly. But ignore it, and you're in for trouble. Plaque's dirty little secret: tartar. Let's say plaque overstays its welcome. If left undisturbed, it hardens by trapping minerals from your saliva, turning into something tougher and nastier: tartar, also known as calculus. Plaque is like the warning sign, and tartar is the real problem. Tartar is a hardened deposit that sticks to your teeth and can stain them, giving you that dull, discolored look. What makes tartar so sneaky is that it can't be removed by regular brushing. It's stuck like cement and requires a dentist to get rid of it. Plaque vs. tartar: how to tell the difference. Here's a quick way to understand the difference. Plaque is soft and can be wiped away with daily brushing and flossing. Tartar, on the other hand, is like that stubborn stain on your shirt that just won't budge without special treatment. Once plaque hardens into tartar, it's no longer your average tooth problem. You'll need professional cleaning to remove it, and that's why dental visits are so important. The silent danger of gum disease. Both plaque and tartar don't just hang out on your teeth for no reason, they bring serious consequences. The bacteria in plaque release toxins that can inflame your gums. When plaque sticks around for too long, it can lead to gum disease. The first stage is gingivitis. You might notice red, swollen gums that bleed when you brush or floss. This is your body waving a red flag. But if left untreated, gingivitis can turn into something more severe: periodontitis. This is where the bacteria start to dig deeper, creating pockets in your gums and even damaging the bone that supports your teeth. Not only does this put your teeth at risk, but it can also affect your overall health. Chronic inflammation from periodontitis has been linked to heart disease and other health issues. The stakes are high, but the good news is, it's preventable. How to keep plaque at bay. Here's the simple truth: removing plaque is in your hands. Regular brushing and flossing are your best defenses. But there's a catch: you need to be thorough. Plaque loves to hide in the spaces between your teeth and along the gum line. If you miss these spots, plaque can quickly turn into tartar, and you'll find yourself in a dental chair getting it removed. To up your game, use a fluoride toothpaste. Fluoride helps to strengthen your teeth and fight off the bacteria that form plaque. And remember, flossing is just as important as brushing. Think of it like cleaning between the cracks in your floor. If you don't do it, the grime builds up. The same goes for plaque. The trouble with tartar. Once tartar has formed, there's no DIY trick to get rid of it. You can't just scrape it off yourself, you'll only end up damaging your teeth or gums. Tartar is tough and stubborn, like that rock-hard gum stuck to the sidewalk. Only a dentist can remove it using professional tools. And sometimes, they'll recommend a deeper cleaning process called scaling and root planing. This goes beneath the gum line to clear out plaque and tartar from places you can't reach. Signs you might have plaque or tartar buildup. How do you know if plaque or tartar is creeping in? there are a few telltale signs. Bad breath that won't go away. Plaque bacteria can produce a persistent odor. Teeth that feel fuzzy. That slimy feeling after eating? That's plaque starting to form. White or yellow goo on dental floss. If you notice this when flossing, it's a sign plaque is building up. Gums that bleed or hurt when brushing or flossing. This can be a warning sign of gum disease. If you see these signs, it's time to take action. Regular brushing, flossing, and visits to the dentist can stop plaque from turning into something worse. Who's at risk for plaque and tartar? Some people are more likely to develop plaque and tartar than others. Here are a few factors that can raise your risk. Skipping brushing or flossing. If you don't clean your teeth regularly, plaque has a chance to stick around and harden. Genetics. Some people are just more prone to tooth decay and gum disease, thanks to their genes. Smoking. Smoking doesn't just stain your teeth, it also increases your risk of tartar buildup and gum disease. A high sugar diet. Bacteria feed on sugar, so the more you eat, the more fuel you're giving them. Stress. Stress can affect your oral health, making it harder for your body to fight off plaque-causing bacteria. Even if you're doing everything right, some things like wearing braces or retainers can make it harder to keep your teeth clean. That's why regular checkups are so important. Takeaway: stay ahead of plaque and tartar. Here's the bottom line: plaque and tartar are more than just cosmetic issues. They can lead to serious dental problems if left untreated. The good news is, with the right habits, you can control plaque. Brush twice a day, floss daily, and visit your dentist regularly. If you suspect you have tartar, don't try to tackle it on your own, let the professionals handle it. Your smile is one of your most important features, and taking care of it doesn't just protect your teeth, it can improve your overall health. So, next time you feel that fuzzy layer on your teeth, remember, catching plaque early can save you a lot of trouble down the road.